Hi, in this video, I'm going to be talking about one strategy you can use to help yourself during breast cancer and its treatment, and that is the strategy of writing in a journal or journaling. Now, you may remember having a diary from when you were younger. You may remember books that start with Dear Diary, and you can certainly journal that way. But your journal is really a place for you to process your feelings, whether they're good things or challenging emotions, events of the day, things you need. It's been shown that journaling about things that are stressful actually lowers inflammation. So the study was done in people with asthma and people with rheumatoid arthritis. Both of those are inflammatory conditions. And people were randomized into one of two groups. One group was told to write just about anything. The second group, which was the intervention group, was told to write about difficult things, to write about challenges specific with their disease, their health, and other issues. And over time, they were followed for, in asthma, the case of expiratory function, so how much you could breathe out in a certain amount of time. And in the rheumatoid arthritis patients, there were measurements of range of motion at the joints using objective measures. The people doing the measures in people with asthma and rheumatoid arthritis did not know whether people were journaling about neutral events or about difficult events. What the study showed is that journaling about difficult events actually lowered inflammatory markers, improved range of motion, and improved forced expiratory volume in asthmatics. So pretty promising. There's been a lot of work done using less sort of objective measures through lots of experts. James Pennebaker is a well-known researcher in this area. And I'll talk to you next a little bit about how to journal. If you've never done this before, how do you start? You're looking at this beautiful journal you bought and you're wondering, what should I do? So there are a couple ways of writing in journals. One is you can go online and look up journal prompts. And you could even probably Google journal prompts for people with cancer. But really, the key thing you want to do is empty your brain, basically a dump of your thoughts, onto the page. Now, if you're a perfectionist or if you like to write and you used to get A's in English, you may get stressed out and you may edit every sentence before you move on. We want the opposite. What we want is something called the hot pen effect, or the hot pen approach, where you take your pen and you keep it moving. Even if it's like this, I'll imitate something you might write. I have no idea what I'm writing. She said this would help me. It's not helpful. I bought this nice journal. I don't know what to say. Just keep writing. And the first time you do it, if it's strange to you, just write for 3 minutes. Ultimately, what you'd like to get to is 3 pages in your journal first thing in the morning. Why first thing in the morning? Well, because that's before we've had a chance to get overstimulated by all the other stimuli in the world, like the news and the family and everything we have to do that day. The other time it can be very helpful to journal is towards bedtime. Now, I advise people not to write in their journal at bedtime because this can get your mind churning and may actually make things worse. I recommend a couple hours before bedtime. This is something I've advised my patients to do as long as I've been a physician. And I've played around with that time recommendation, and 8 o'clock seems to be the right time. If you go to bed at 10 or later, if you go to bed at 9, you'll want to move it even earlier. So morning or evening, giving yourself time to sort of leave what you left on the page and do something else before you get ready for bed. Read a book or talk with a friend on the phone, or try not to watch the news, but taking in other media, and then having your bedtime routine. If you've been used to journaling, it's very common for people to stop because, like everything else in your life, things are turned topsy-turvy and people are calling you, and that's when you were going to write in your journal, or you need to leave to go to the doctor's office when before the morning time wasn't your time for radiation, it was your time for writing in your journal. I would encourage you, if this has been something you've done before, until recently, or you used to do in the past, to pick it up again, Just the thought of reducing inflammation in your body, even if it's theoretical, is promising. The other thing is this can help you figure out what it is you need. So one prompt might be, what do I need right now? And then you just hot pen it out. I need to be listened to. I need to be loved. I need to be told I'm beautiful. I need to be told things will be okay. And that will help you when you go to your doctor's visit, when you talk with your friends, people from church, your partner, your kids, your parents. It can help you work out what is it you need. Another thing, another prompt might be something like, how am I feeling? I'm feeling scared. I'm angry. I'm feeling okay. And I'm a little freaked out that I'm feeling okay. So what do I need? How am I feeling? What's bothering me? What do I need from my medical team? Some of these are great prompts. What's keeping me up at night? That's a good one to do in the morning, because you don't want to do that in the evening and then have that keep you up at night. If you wake up in the middle of the night, journaling is a great thing to do because your mind is spinning. You might be ruminating. The word comes from animals that have multiple stomachs, and their food basically gets recycled through their stomachs. I'm a really expert ruminator, and at night, one of the things I'll do if reading doesn't work for me is I'll write in my journal, and I usually get quite sleepy and can fall back to sleep. That might work for you. We don't know. So journaling is a strategy that's actually sometimes called part of integrative medicine or alternative medicine, but it's such a natural thing for us to do. We tell stories all the time. This is for you. This is a way for you to get out things maybe you're scared about and don't want to share with people, or a way for you to put into words what it is that you wish you could say to people. So let me know in the comments, is journaling helpful for you? Is it something you've done? Do you want us to share some prompts with you? We can do that in a link along with this video. If you're interested in learning more about treatment options that might be offered to you, you can visit yerbba.com for your personalized report. And if this video has been helpful, click like and subscribe, because that helps other people with similar interests and questions find this video.